morning, Dr. Soto. How are you doing?
I'm great, thanks. How are you?
Good. I'm a little confused.
Oh.
There are so many different options of liposuction, and all
Sure.
different doctors have different kinds. But I was wondering, what's the best? Which one's the best method?
Wow. Well, let's just hit the nail right on the head here and say there is probably no best method for everybody. Okay. Your best bet is to find a really, really good surgeon who's certified by the American Board of Plastic Surgery. The truth is that if you find a surgeon who's really well trained and experienced in body contouring, and you have a good relationship with that person, he could or she could use any liposuction machine and give you a good outcome. That's the truth. There's an old saying, right? It's the carpenter, not his tools. It's the Indian, not his arrows. I mean, there's lots of ways to say it, but the bottom line is that if you have a really good professional handling the instrument doesn't matter. Now, there, it seems, are machines being produced once a week, promising to make your skin go away, make your fat go away, make your love life better, find you a rich guy, all kinds of things, right? And it's very confusing. Patients are confused, doctors are confused, and that confusion is deliberate. You know, those companies' marketing arms are deliberately trying to confuse you, and the irresponsible doctors who are using these devices are deliberately trying to confuse you. They don't want you to know that their machine really can't deliver on these promises that they're making. They don't want you to know that they're not plastic surgeons. You know, in Orlando alone, there's a urologist, an eye doctor, and an ER doctor, all saying that they're liposuction experts. And I can tell you, because I see their patients, that they're not experts. I know one of them has punctured lungs, one of them has punctured bellies. You know, these are terrible complications that can cost somebody their lives. And it's because they're able to confuse the public into thinking that they really know what they're doing, that these things are happening. So it is very confusing, but I think the bottom line is find a surgeon certified by the American Board of Plastic Surgery who knows what they're doing when it comes to body contouring, and then trust them to recommend to you what technique is best for you. The second point to make is that the devices have been coming out, as I say, probably once a week. And we have been confused about what are the important questions to ask. You know, the companies come out and say, we should all be excited. This machine makes your fat go away. Well, guess what? That's not really that special. We should not be asking the question, does it work? What we should be asking is, does it work better than what we had before? Is it safer than what we had before? And is it less expensive than what we had before? If we ask those questions, most of these machines are not an advancement. Most of them are a step backwards because they're not better, they're not safer, and they're certainly not less expensive. They cost a lot more. For example, if I walked into the room and I smiled at you and said, hey Amy, you have got to buy this expensive machine that I just invented. It has 4 wheels and a steering wheel, and it will take you where you want to go. You would start laughing and you would say, Dr. Soto, I've got a car. I've had a car for a long time, and I don't want your car unless it's better than the one I've got, right?
Right.
Well, that's kind of what's going on with these machines, you know. They're coming out and they're saying, hey, look at my machine, it makes your fat go away. Well, duh, we've known how to make fat go away for 40 or 45 years. So what we really should be asking is, okay, is your machine better than what we already do? Is it safer than what we already do? Is it cheaper than what we already do? And if the answer to one or more of those questions is no, then I don't want your machine. But we have irresponsible eye doctors, urologists, and ER doctors, and other people like that who really are trying to make more money, okay? And so they're convincing people that their machine can do things that it really can't, to distract you from the fact that they're eye doctors, ER doctors, and urologists, and to distract you from the fact that it's really not an advancement. So you have to be very careful with liposuction nowadays, or with any kind of body contouring. The best way to be safe is make sure that your surgeon is certified by the American Board of Plastic Surgery. Okay, make sure they really do know how to do body contouring. And be very skeptical and scared of somebody, whether they're a plastic surgeon or not, who tells you that their machine is the reason you should be there. You know, if the machine is the reason you should be there, why did they go to school? Why did they do training? It really, it should be about their training, their education, their experience, their outcomes. Those are the things that they should be telling you as reasons why they're a good provider of healthcare for you. I don't think I would ever tell somebody that my machine is the reason that they should let me operate on them.
All right. Well, thank you so much, Dr. Soto, for clearing that up for me.
My pleasure, Amy. Let me know if you have more questions.
Thank you. I'll see you tomorrow.
Okay, bye-bye.
Bye-bye.